This is Dr. Paul Steinke from Active Life Foot and Ankle in South Lake, Texas. And today what we're doing is we're removing a great toenail secondary to injury. Now this patient was riding his bike and bumped the toe aggressively against the rock, I think you said, yep. So the nail, unfortunately, there's a fracture underneath that nail and that causes bleeding on the underside of the nail. Whenever we see a trauma to a nail that has greater than 50% of that nail bed with blood underneath it, unfortunately the nail has to come off. That's for two reasons. One is for pain, and one because there's all that pressure in there, we want to get that out, but more importantly, we're worried about there being a laceration or a tear in the nail bed. And if we leave that exposed, the patient could go on to infection in the bone. So what we've done already today is we've numbed the toe up, and I'll confirm that it's nice and numb before I start. And we're going to clean the toe, and then we're going to remove the nail, and you'll see that in just a moment. So if you look at this nail, you can see it's very dark in comparison to the adjacent nails, and that's because of the blood underneath there, and then the nail is very mobile. This nail is already really released from the underlying nail bed. So the first thing we're going to do is we're going to see if we can drain some of the blood out of there without squirting ourselves with it. And there it came squirting out right away. You can see the blood underneath there, and a lot of it's serous fluid, which is just normal fluid after an injury there. It's not necessarily just blood. And then we're going to release that nail from the surrounding skin here. Like I said, he's done most of the work already. If we didn't take the nail off, what would potentially happen is the nail just would not grow back. You can see I didn't even release that tissue and I'm underneath the nail. So here's the money shot everybody wants to see, unfortunately, when it's not their toe. Yep. Not a good look, right? But, well, that's dried blood, so let's get rid of some of that. And the fracture is more downstream here in the tip or the tuft of the toe. And lucky for this guy is I don't see a laceration in the nail bed. So essentially afterwards, we're going to put a dressing on here. You know, at home, he'll be cleaning this little wound cleanser. I'm going to slide your foot over just a little bit. I'm trying to get myself wet. It's a little rinse there. And we're going to pat that area dry. And they don't always bleed very much afterwards because, again, he did all the work. It was already loose underneath. The bleeding had kind of subsided a little bit. So again, we're going to put a little dressing on here, and I have a little ointment on this, and I'm going to put that right on the bed. And you can see this, he does want to bleed a little bit. So we're going to be quick about the dressing, but the ointment goes on the bed, and if I put a piece of gauze right on top of that space, what's going to happen is when he changes the dressing, it's going to get stuck. And he's going to call my office and say how much it hurts, and I'm just going to tell him to yank it off. So we don't want that, okay? So on this is a piece of petroleum gauze. There's a million different types of this, but this is a non-adherent gauze that goes over that space. And then you put the gauze on the surface so we don't get that to stick. Now this will bleed a little bit, and that's okay, that's normal. And he may change this once today, but moving forward after today, it's just once, or I should say once or twice today, but after today, it's usually once a day. As the bleeding starts to slow down, then we're gonna be able to make that dressing a little bit smaller. More gauze here. I just don't want him to bleed through. It's a bad look when he gets in the lobby and there's blood on the floor. We don't want that. But we just gently wrap this around the toe. We're not putting this on there like a vise. You put it on too tight, you're gonna cut off the circulation. So just kind of a couple of wraps around that. And again, every day they'll get smaller. So hopefully just in 5 days, we're back to a Band-Aid and that's it. And that's removal of toe, a toenail for fracture. But if it was just a toenail removal for some reason, literally we're just wearing a bandage for 2 weeks and then we're back to normal activity. Because I didn't kill the nail, it will grow back. It'll just take about a year, unfortunately, for full regrowth. With the fracture, because he did fracture his toe, he's gonna be in a post-operative shoe to 2 to 4 weeks. And because it's not a big fracture, usually he's back into shoes and back to normal activity at that point.